But the Public Health Act gives power to the Minister for Health, Mary Isaac, to do whatever is necessary to protect the lives of citizens. And with the command center to the COVID Prevention and Control Act, Dominic Pede is in charge of that command center. The Minister for Tourism seems to be heading the response of a public health emergency.
Former Health Minister Alvina Reynolds continues her criticism of the Shastny administration's policy approach to the COVID-19 pandemic. Like other critics, the ex-Babonneau MP believes that the policies have been tourist-centric.
What does that say to us? Is it that the PM has no confidence in his Minister for Health, the one he appointed? Or is it that his only focus is on how the pandemic affects tourism? The CMO is the deputy chair of the command center. CMO can only act in an advisory capacity. Fede is not obligated to take that advice. So I'm asking, who is best placed to coordinate with local, regional, and international public health interests a holistic response to the pandemic?
The former health minister cites as part of this holistic response local organizations like the SLMDA and regional groupings like CARPHA, the Caribbean Health Public Agency, the Pan American Health Organization, PAHO, and the region's ministers of health. Reynolds says the Minister of Health should be the island's key liaison where these groups are concerned.
To coordinate, to reach out, to have Fede attended any of PAHO's meetings, any of CARPHA's meeting, any of CARICOM, Minister's Head meeting, Health Minister's meeting. Will the Minister for Tourism give directives to the health institutions, the private health institutions, and the public health institutions? To me, the Public Health Act gives powers to the Minister for Health, and the COVID Act took it away along with Cabinet. Where is the Minister for Health?
Now, on a regional level, calls have been made for a more harmonized approach by CARICOM governments towards mitigating and controlling the spread of the virus. The so-called CARICOM travel bubble, established during the last quarter of 2020, was short-lived as regional governments ultimately could not agree on protocols.
I remember during the Ebola scare that we had during my time, the ALBA countries had an urgent meeting in Cuba where support was pledged by Cuba and Martinique, etc. And Martinique supported the OECS territories in terms of what could be done, what they were willing to do. Cuba through the ALBA territories, and Dr. Anthony, and myself, we attended this meeting and were able to see what can we do in a coordinated approach and response. I know each country has to face its own, but not even in terms of vaccines. I'm not hearing that. I know the OECS is the one procuring medication for OECS countries. I am not hearing much.
The former health minister asserts that the absence of updates from her successor likens St. Lucia to a, quote, ship alone in the middle of the Caribbean, end quote. Miguel Favre, NBC Prime.